Hi, today I'll be going over the QA reports that we did this last quarter. Our first report would be our Casper report, and this report is what we get from the CMS website. These are a list of the potentially avoidable events. For the fourth quarter of 2018, we had 4 potentially avoidable events. 2 of them were emergent care for hypoglycemia. 1 was a development of urinary tract infection, and the other one was discharged with an unhealed stage 2 pressure ulcer. Out of the 4 potentially avoidable events, 2 of them were errors. And the errors we pick up once we look at the OASIS, see if patient actually had as pressure stage 2 ulcer. And it looks like the patient's ulcer was healed, but the person discharging put that the patient still had an ulcer. The second reports are infection reports. For the first quarter of 2019, we had a total of 1,815 patients on service. 217 were at risk for wounds. 39 of those were surgery wounds, and 178 were non-surgical wounds. The actual number of infection of wounds were 9. We are at a 4.1% of infection wounds for our patients at risk. We had a total of 128 patients at risk for UTIs. 60 of them had catheters, 68 did not have catheters. We had a total of 10 UTI infections, which put us at 7.8%. For our respiratory infections, we had 116 patients at risk. 70 of them were COPD. We had a total of 14 respiratory infections for the quarter. That put us at 12.1%. For GI infections, we had 46 patients at risk. We had a total of 2 actual infections. That gave us a 4.3 of at risk. For sepsis infections, we had 0. Employee infections, we had 0. And other, we had 0. Our next report is our incident report. For the first quarter of 2019, total patients on service, 1,815. We had 74 patient incidents. 73 of them were reported, and 1 was witnessed. There was a total of 72 falls, 36 with injury, 36 without injury. The other 2 patient incidents, a patient stubbed toe in a garage and there was a bruise to toe. The other 1 patient dropped knife on foot and caused a cut. We had 10 employee patient incidents, and this would be for not following protocol. 1, a recert was missed. 2, LPN did a visit with no ROC done. 3, SN going through meds in the bag, and the bag had rodent urine and feces. 4, SN documented OT eval on 485 but did not request auth. This happened twice. 5, LPN missed visit and didn't look at KML or check hotbox. 6, RN that opened did not give report to confirm SOC with intake. RN was sick and patient was not restaffed. 7, home health aide was seeing patient 3 times a week. Order was for 2 times a week. So we had a total of 84 incidents for the quarter, and that put us at 4.6%. Our next report is our hospitalization report. For first quarter of 2019, we had a total of 167 rehospitalizations. So it was 157 plus 6 scheduled surgeries and 4 higher level of care. That put us at 9.2% of total readmits. We had 6 patients same day as SOC and 46 patients from days 1 through 14 from admission got rehospitalized. The highest reason for rehospitalization is respiratory other, which was 17 cases. Next to that, respiratory infection, 13 cases. CHF 9 cases, fall with injury 9 cases, GI bleed 9 cases, pain 9 cases, wound infection 8, chest pain 7. Other reasons for rehospitalizations were anxiety, blocked central line, dysrhythmia, chest pain, confusion, dehydration, malnutrition, dizziness, low or high blood pressure, liver cancer, ongoing infection, paralysis, stroke, unresponsive, nausea, vomiting, diarrhea, weakness, unable to urinate, Foley complications, organ failure, fluid overload, hip dislocation or fracture, and abnormal labs in UTI. Our next report would be our Home Health Compare Star Rating CAHPS report. As of January 2019, this is from OASIS assessment data from October 1st, 2017 to September 30, 2018. For question how often patients got better at walking or moving around, we are at 71.6%. National average is 74.8%. How often patients got better at getting in and out of bed, we are at 88.8%. National average is 74.1%. How often patients got better at bathing, we are at 87.0%. National average is 76.8%. How often patients had less pain when moving around, we are at 76.9%. National average is 77.8%. How often patients' breathing improved, we are at 82.2%. National average is at 76.7%. How often the home health team began their patients' care in a timely manner, we are at 99.2%, and national average is 95.8%. How often the home health team taught patients or their family caregivers about their drugs, we are at 82.7%. National average is 64.6%. How often patients had to be admitted to the hospital, we are at 20.8%, and national average is 15.3%. All this information is gathered from the CMS Quality of Patient Care Star Rating report that is on their website, and this is the process reports, or I'm sorry, the process measures. According to the CMS report, we are at a 4.0 stars right now. For our CAHPS report, there was a total of 57 surveys completed, 254 patients were surveyed. Our return rate is 22%. Our overall rating of care is 79%. I'm sorry, I was giving you the previous quarter. So this is for a 3-month period ending February 2019. So this is the most current one. Our overall rating of care is 85%. National average and the Arizona average is 85%. Our likelihood of recommending, we are at 78%. National average is 78%. Arizona average is 69%. For care of patients, we are at 88%. National average is 88%, and Arizona is 86%. For our communications, we're at 82%. National average is 85%, and Arizona is 82%. Specific care issues, we are at 82%. The national average is 83%, and Arizona is 76%. So it looks like we are definitely meeting the percentages for our CAHPS report. Our last report would be our performance improvement projects. And goal number 1 is to improve patient satisfaction, recommend us to others. We want to be at national average, which is 78%, and we met it this quarter. Last 3 quarters we did not meet, but this quarter we are at 78%. Our goal number 2 is to decrease all rehospitalizations. We want to be at 6% or less. We were at 9.2% for this quarter. We did not meet rehospitalization rate. Our goal number 3 is to decrease rehospitalizations from days 1 through 14. We want to be at 25% or less. We did not meet this goal. We were at 27%, but we did have a decrease. Previous quarter was 33%. Our goal number 4 is to decrease UTIs to 10%. We met this goal. We were at 7.8% of UTIs. Our goal number 5, decrease wound infections. We want to be at 2.0%. We did not meet this goal. We were at 4.1% this quarter. Goal number 6, decrease incidence to 35. And we did not meet this goal. We were at 84%. So all goals will remain the same for now. And this is it for our quarterly QA report meeting.